There's some life-saving legislation that we need to get reinstated in this state, and we'll tell you all the stories about why. Welcome into My State of Mind. I am Dan Yorke on this Friday evening. Now, you might be a little confused if you've been following the conversation here. On our Monday program, I had my guests in here. I had 4 guests talking about the expired Good Samaritan law, which needs to be reinstated in some way, shape, or form immediately, which helps people when they're in trouble with a drug overdose. Someone calls 911, doesn't necessarily have to get jammed up with the cops, you know. But we had a little decision about carrying over that conversation on Monday. We thought we might do it Tuesday, but instead it's a big viewer night on Friday night, and I think I want everyone to really understand what's happening with this story. And so welcome into My State of Mind. No rundown this evening. And you know, on Friday nights we try to expand the conversation a little bit and go a little bit more in depth, as much as a half-hour television can do for us. And remember, we're on Fox Providence now, in addition to MyRI-TV, Fox Providence at midnight, and MyRI-TV 7:30 and 11:30. Here's the headline that grabbed me originally to have my guests in this segment on the broadcast, and this is not necessarily the controversy. I mean, this is about the challenge out there with opioid overdoses, the use of Narcan, taking the fight to the streets, and the man pictured in that June 11th, I believe, story in the Providence Journal, or June 7th, whatever. June 7th, not June 11th, is Ray Joseph, Prevention Supervisor for AIDS Care, Ocean State. Welcome.
Thank you.
Nice to have you. And Jonathan Goyer is a project director or program director for Project Weber, which is what? Welcome to the program.
Project Weber is a nonprofit organization funded to provide services to an at-risk targeted population.
Meaning?
Of men on the street. Meaning incredibly high-risk population of men.
Okay. High risk for?
High risk for HIV, for STDs, for overdose.
All that.
All of that. All
right.
that good stuff.
So you got some juice in the paper. That was good. Yes. You've been working in this kind of field for a while now.
Yes, for 10 years I've been working with my company, AIDS Care Ocean State, ACOS for short.
That's your company?
Oh, I'm the prevention supervisor.
Okay.
I oversee all things prevention,
okay,
which include HIV testing, hepatitis testing, backpack street outreach program, and Rhode Island's only needle exchange program.
Okay. Boy, needle exchange is almost like a throwback conversation. I was telling you prior to the broadcast that back in the old days, I used to say, no taxpayer money to give people the tools to use drugs. And I don't know if it's age or wisdom or a combination of both. You finally say, listen, you know, people are dying out there. Don't. So I'm not battling you anymore.
Not battling? Oh, there we go.
Tell me about your work.
So I oversee all things prevention,
right,
which include the HIV and hepatitis testing. We do about a third of the testing within the state for HIV and Hep C. I run Rhode Island's only needle exchange program, so I cover all parts of Rhode Island from Woonsocket to Westerly, all parts in between. We do a street outreach, which we incorporate all of that into a home-based delivery service, and we just started distributing Narcan in collaboration with Project Weber and Miriam Hospital.
And the market need is what?
Market need is very high. As 2012, I believe, or 2013, the only community-based distribution program for Narcan, the Pony program, they shut down, and so there was no community distribution. People had to go to pharmacies or only pharmacies or the hospitals to get Narcan, pay out of pocket or use insurance. A lot of the population we serve are underinsured or have no insurance, so we picked up the slack and was able to distribute them for free.
Right, this whole Narcan thing, everyone's talking about the Narcan, but how do you always say this diplomatically, the population that's not involved in the use of drugs or in high-risk situations really doesn't know what the heck it is or how to use it for the most part, right? So
correct.
You were thinking you may want to explain that a little bit more.
Yes, so Narcan is a prescription that reverses the effects of an opioid overdose. Opiates being prescription painkillers, Percocet, Vicodin, OxyContin, fentanyl, morphine, and then illicit drugs, which is heroin. doesn't have to be a heroin overdose. Doesn't have to be an IV heroin user that can experience or be at risk for an overdose. Could be somebody taking Percocets out of their medicine cabinet at home.
Right. Well, we've talked about that in the past. I mean, all the stereotypes about people who are now overdosing on drugs and this terrible stat that we're dealing with in Rhode Island with the number of deaths is not just, for the lack of a better term, and again, excuse the picture, you know, the derelict on the street corner just injecting himself all day long. This is a widened population now, correct?
Correct.
All right, so what does this thing do? You're going to kind of...
Well, you wind it up
Well,
and it
No, I mean, seriously.
So these are the kits that we hand out,
Yeah.
and in here is 2 doses. So we give them the syringe to inject with. Through the pharmacies, they can buy the intranasal Narcan, but the ones that we give are intramuscular, so they can be given out in one of the big muscles, leg, thigh, butt, arm. There are the 2 vials here, and the package insert, and we have a little cheat sheet that we give out too.
So when you're on the street, you're in the neighborhood, in the community, you are doing what? You're teaching people how to mix this thing and get going and inject right away.
Not only teaching them how to inject right away, but also how to spot an overdose and what to do in case of an overdose and how to inject right away.
All right, so give me the 30-second version on that. What are you telling me?
So we want to look for, if somebody's overdosing, we want to look for blue lips, pale skin, unresponsive or heavy breathing. If somebody is experiencing one of those, you can call 911 right away, hit them with the Narcan, and then you could also perform
Blue
rescue.
lips, pale skin, whether you're white or black?
Whether you're white or black, you'll see pale.
It's,
Yep.
okay.
It'll look like they're not there, almost like a ghost.
All right, okay.
Hit them with the Narcan, call 911, and you could also perform rescue breathing. So we tell them the same things as CPR without the chest compressions.
Got it. You hit them anywhere with the Narcan?
You want to go for one of the big muscles, leg, arm, thigh, butt.
And how quickly does it work?
Usually about 3 to 5 minutes you'll get a response. And if you don't get a response, that's why we give 2. You can hit them with the second dose and continue with the rescue breathing.
The drug users are trained.
Drug users as well as
but
their
but
friends.
when they're in distress, they can't hit themselves.
They can't hit themselves, no. But we do encourage them to bring their friends or family members, whoever's around with them.
What kind of volume of use do we have out there?
So I think it's incalculable on different degrees, different levels of use.
No, I'm talking about how many, on average, say monthly. How many
How many vials are administered?
How many people are saving others?
Well, last year, if you include EMTs, a lot of police departments are carrying it. Along with what we distribute on the city, there's over in the state, there was over 2,200 doses of Narcan administered in the year 2014. That saved 2,200 lives.
That's amazing. Now you've got some experience because you are recovering, correct? When we come back, that's correct.
That is correct.
All right, when we come back, I want to hear that part of the story, and then we'll talk about the politics of this a little bit later on. Stay with us. So listen, right now we're in this limbo land, and in our next segment, not this one, but the next segment, we're going to talk about the politics of this law that is now expired and hanging in nowhere's land, and the Attorney General's efforts to kind of cover up whatever problems existed without, I don't know, it's just a kind of a half a mess here, and lives are at stake. And a lot of you are going to think, Dan, why didn't you turn into such a bleeding heart liberal on all this stuff? You know, you want these drug-saving laws, and you know why? Because you got to face the facts here. We've got some serious problems and growth of opioid addiction that surpasses the stereotypes, surpasses, not that I wasn't concerned about people who were just down on their luck and shooting up heroin in the streets, but the truth is that this thing has gotten too big, it's getting out of hand, and our experts in the next segment will help to explain that and the politics of it. Am I right? It's really getting crazy out there.
Yes.
How did it explode so much?
A whole number of different things. People on painkillers, going from copying things from their friends, experimental drug use, to going to searching through their mother's cabinets, to routine use.
So Ray, when you're dealing in the community, are you dealing with the executive who went in for some back spasms and got some medicine, or a knee operation and got some medicine, or a tooth removed and got some medicine, and just started taking them and felt like, well, this is the greatest thing in the world, and then got hooked? Or are you dealing with people who are stealing medicine, second, third, fourth hand transfers? What are you doing?
I'm dealing with both.
You are?
Yes.
How are you finding the executive is hooked?
They'll hear about us through the grapevine because of our program. I mean, mostly through word of mouth.
That must be something when alleged pillars of the community or people in upper socioeconomic stature end up having to call your organization. That must be a mind blower for them and a real gut check moment.
Mm-hmm.
Yes?
Yeah.
So the nature of your clientele has changed over the 10 years that you've been dealing with this.
We're seeing a wider variety of people, yes.
And Jonathan, you've gone through this. You've lived this.
I have.
What is your story?
So my story is for the better half, or the worst half, I should say, of the last 10 years. I've suffered from addiction, primarily opiates, on and off again, on and off different medicine-assisted recoveries and trying different avenues of recovery and just not being able to stop. That's what I remember. I remember being so stuck in my opiate addiction that I wanted to want to stop, if that makes sense.
You wanted to want to stop.
I wish I wanted to stop, but I couldn't see the hope in it. I just couldn't. I was
How'd
so
you get into
deep.
it?
How did I get into it? You know, it's a good question. You're having fun, all of a sudden you look up 8 years later, and you're saying, how did I get into this? It just, it happens. It's just a progressive illness.
Okay, so your drug addiction didn't start from this unwitting thing that's happening with a lot of people now who are taking these prescription medicines and thinking it's okay and then having them catch it. You were partying.
I was partying with prescription medicines.
Okay.
And
this is weird, man, isn't it?
Is it weird? I think this is weird.
Yeah. What's weird? Being on television's
yeah.
weird? Talking about it's weird? Yeah, it's all weird, I guess.
Yeah. So for me, my disease of addiction, it just progressed. It progressed. I slowly began making compromises, saying, draw a line in the sand, like, okay, I'll do this, but I won't do that. And then you draw the line in the sand, you keep walking over, you keep compromising. Next thing you know, you're a high school dropout, living on the streets. And for me, it progressed to the point in 2013 where I did find treatment. I did seek treatment into a detoxification center and into a residential treatment center. And I was doing really well. I had about 7 months clean. And then all of a sudden, I can't explain it, but one day, I just reverted back to opiate use. Fighting the disease of addiction every day is a hard thing to maintain that one day at a time mentality, particularly when you've been subjected to that lifestyle for 10 plus years.
And so now you've been in recovery again for how long?
For a little over 2 years. So back in June of 2013, I was actually living in a recovery environment, doing well. Everything looked good, and I made that one bad decision to revert back to opiate use, and I overdosed. Thank God, I was in a recovery atmosphere with people that are aware of the risks of people that are living in an environment like that, and somebody had Narcan and actually hit me with Narcan.
So you're here because of that thing, right?
I am, yes.
This saved your life.
Correct.
Well, that's real.
Yeah. Thank God. And as Brady said, there's 2 doses in there. It took more than that for me to snap out of it at the time. But it kept me alive long enough for the ambulance to come pick me up. I began to gain consciousness, and I was brought to the emergency room.
Was that the last one?
That was the last one. For me, having used substances for years and years, it was that moment that I realized, my drug addiction took me to some interesting places in life. It took me to jail. It took me to institutions. It took me to different states. I've been to different countries, sort of serving my addiction, right? Going wherever the next fix is, and when I woke up from the overdose and I came to, I just had this realization that, I'm not going to end up back in jail. I'm not going to end up in a treatment. I'm going to end up dead. The party's over. This is it. And that was clearly evident to me. So I guess you could say that that served as a sort of spiritual awakening to really sit and think about my life and what's going to happen if I continue down that path.
So now you're working with the community on the very issue.
I am, yes.
Is that therapeutic?
Being
in it all the time?
Well, It is. I believe I'm fortunate enough to have the opportunity to live through it. So I feel sort of obligated to share my story with other people and hope that I can help somebody. As far as volunteering, I volunteer for Miriam Hospital's PONY program, which is Preventing Overdose and Naloxone Intervention, the only community-based organization that distributes free Narcan in the state of Rhode Island. I volunteer because as a person that suffered from addiction and everything that goes along with that, I took a lot from the community. It's an incalculable amount of damage that you cause when you're in active addiction. So this is, I feel a sense of relief being able to be in recovery and give that back.
I got to tell you something. Your command of your story and your articulate skills are evident. So clearly your head is clear, and
it's amazing.
I congratulate you on that.
Thank
Praying for you that you keep going. Yeah. These are the kind of people that you're helping.
Yes.
Not to point, not to be, right?
Yep.
So what's the message as we go into the next segment and talk about the legislation that's desperately needed? Your call to the General Assembly to say this stuff needs to get into people, and people should be able to call an emergency number without fear is...
It's true. I mean, people should be able to call 911 without fear of prosecution, without having cops come in and bust them for any drugs. Making sure the General Assembly knows that, make sure that we pass this bill.
Okay. When we come back, we'll talk about the politics of this bill. Stay with us.
Good Samaritan laws do save lives. Good Samaritan laws have saved lives and do save lives, and it is frustrating and disappointing that the General Assembly left this building in this session without addressing this issue. And this is, it's an unacceptable situation, and I urge the General Assembly to reinstate these protections as quickly as they're able to.
So I played that Monday night. My guests are back here tonight to kind of expand on the politics. Rebecca is the executive director of the Protect Families First group, and Michelle is a researcher over at Miriam and does really important work. I don't want to beat up on the governor, but, you know, it's easy to come in when the General Assembly just quit for the day and say, by the way, you should have done this. If this was so important, I don't know if you guys have an opinion on this, but if it was so important, where the hell was she when they were kicking the can down the road here? Yes? No?
Yeah, I'm wondering where everyone
You don't want to look a gift horse in the mouth, but right?
Yeah, no, I'm deeply concerned that this legislation was left on the table unaddressed.
All right, and you need to know, if you just tuned in, we're talking about this Good Samaritan law, which had expired here in this General Assembly session and wasn't renewed because you tried to, the advocates, advocate community, tried to add things back in.
Yep,
correct?
we were pushing for added protections to make the public health message clearer, and also to protect one of the highest risk demographics, which is people who are leaving prison. I mean, people get locked up for drug offenses. Incarceration isn't treatment, so people leave incarceration without ever having, you know, really entered treatment recovery service, having been supplied with treatment recovery services.
The Attorney General got in the mix, and if you missed all the play-by-play on this, what happened, Rebecca was with us this past Monday. You can look at foxprovidence.com and see the show. I don't want to repeat all the notes, but the headline is right here. AG issues a memo on Good Samaritan cases. For the most part, what he said is, all right, listen, police, check in with my office before you do something. I don't know what the do something is. I mean, in the middle, an officer's got to make a decision whether or not he or she's going to detain somebody, right? So you guys have thoughts on that?
Well, he is encouraging police officers, from the letter that he wrote, he's encouraging the police officers to arrest. So it is using the arrest tool. And then suggesting that the folks they arrest be referred to the Attorney General's office. The problem with
people don't want to be arrested.
Well, they don't want to be arrested, and the resources available through the drug courts and through there's a diversion program are very small and could no way provide enough treatment or coverage or sort of case management that would be necessary to address with the addiction problems in our state.
Well, I think off of what Michelle said, what my initial response to the Attorney General's letter, was that there was a phenomenal program already in place happening at the scene of overdoses. So under the Good Samaritan law, one of the things that developed as part of 911 response was Anchor Recovery was providing emergency room peer recovery coaches. So overdose victims would be transported to a hospital after 911 arrived, and at the hospital, a recovery coach would come and meet with them and provide them with Narcan, or naloxone, the same thing. And they were having really tremendous results of people willingly entering some form of either inpatient or outpatient treatment program. And the real bottom line is that's how we get people treatment. We need people to survive in order to get them to the point of treatment and recovery. And if people are too afraid to call 911, we're going to lose lives in that process. So we had this really great program working where when people got to the ER, they met with a coach. Now they're being met with handcuffs, on a dead body, frankly. So, and that's if 911 is going to be called.
Are you worried that there's going to be a huge spike this summer without the law? I mean, the numbers are too high already.
Exactly, the numbers are too high already.
But you think you're going to get a spike?
I am very concerned that this undermines the public health infrastructure that we've been working to create, a large piece of which is what Rebecca just described. And by moving toward using the criminal justice system to get people into treatment, an outcome of that is when people can't comply with the terms of the treatment, then what's waiting for them are even longer sentences. And so we're again spending more resources, and people will end up even spending more time in jail. It's honestly, when we look at the efficacy of it, which we know is we need people in the community providing supports regularly, and when you look at the expense of it, I don't see how we can afford it.
Give me 30 seconds on how we got here. How do we get here? It's a mess.
It's actually a really great question, and we are in the middle of an opioid addiction epidemic, and it really goes back about 15 years. Whenever the medical establishment decided that the way to treat pain as standard procedure was to prescribe opioids without really understanding the consequences of that. So there was a dramatic increase in the prescribing of opioids for both acute and chronic pain. And once the opioid, that is the pain relievers, the Percocet, Percodan, Vicodin, once that reached people's homes, so you were the person who received the prescription, but then don't we all share? I mean, if you're just like, oh, well, you've got a backache, I've got what can help you. And so it was prescribed. There was a huge rise in prescribed. There continues to be. And then even the people would have access to the opioids when it wasn't prescribed to them. And 80% of the people who are now using heroin, at least 80% began for prescription opioids.
It ain't your grandfather's drug problem,
no.
Is it? All right. Well, listen. We failed in 2 shows to tell you the whole story. But as the politics of this thing move, and over the course of the summer, come on back and we'll check in, keep the heat on a little bit, at least from this corner of the world. Okay.
All right.
All right. Thanks. Thanks for your work. Appreciate
Thank
that.
you.
One more thing we come back to. Hopefully we don't see a continued spike in this opioid overdose thing. By the way, the heroin thing that you're always, how people get there now is through the medicine cabinet in too many ways. So the General Assembly really dropped the ball on this one. And waiting till September, not a good thing. We'll talk more about it on the radio. See you every weekday, noon to 3 on WPRO. And don't forget, MyRI TV, 7:30, 11:30, and now Fox Providence at night. Good night. Have a good weekend.